name is Anagha Pasumarthi, a rising senior at Abbey Park High School in Oakville, Ontario, Canada. Today, I'm honored to present a topic that blends my passions for biomechanics, technology, and global health, a presentation I call Advancing Global Mobility Through Gait Biomechanics. Outside the classroom, I worked in the Gait Biomechanics lab at the University of Guelph, where I explored how people walk, move, and recover from injury. I am also a co-founder of a youth-led nonprofit called Wither Flowers, which supports women's health and mental well-being, and I serve as a president of Tech for Change, a humanitarian tech club at my school. As a piano teacher, youth volunteer at a local hospital, and an aspiring surgeon, I'm deeply committed to building a future where innovation serves everyone, not just those with access or privilege. Let's start this presentation with a big picture question. Why does mobility matter in global health? Over 1.3 billion people worldwide live with some kind of mobility impairment. These can result from stroke, cerebral palsy, Parkinson's disease, spinal cord injuries, or simply age-related decline. But mobility is about far more than just movement. It's about independence, dignity, and the ability to care for oneself. It affects everything from nutrition and hygiene to education and employment. According to the Global Burden of Disease study, mobility disorders rank among the top contributors to disability-adjusted life years, or DALYs, in nearly every country. That means people are not just sick, they're unable to live full, independent lives. This is especially true in low-resource settings where support systems are often fragile or absent altogether. So, how do we detect and address these issues? In high-income countries, we rely on gait diagnostics, using tools like 3D motion capture systems and force plates. These labs can precisely assess how someone walks, detect abnormalities early, and help tailor rehabilitation plans. But here's the problem. These labs can cost over $100,000, require specialist training, and are almost entirely inaccessible in rural or underfunded areas, which are the exact places where need is the highest. So, what happens when someone in a rural region starts to lose balance, drag a foot, or limp after a stroke? Too often, they are left undiagnosed, untreated, and unsupported, which increases their risk of falls, injuries, and long-term disability. This is where my research experience comes in and where technology has the power to transform global health. Let's talk about the solution. Printed pressure sensors. This is the core technology inside smart insoles. These are ultra-thin, flexible electronic sensors that can be 3D printed or screen printed onto inexpensive plastic or fabric materials. They contain pressure-sensitive layers, almost like a conductive sponge, that generate a small electrical signal when stepped on. Each region of the insole can measure different aspects of how the foot strikes the ground. This gives us a real-time pressure map of someone's foot during walking. In more detail, let's walk through how these smart insoles actually help step by step. A patient puts on a shoe fitted with the printed sensor. As they walk, it captures detailed data on things like pressure, balance, step timing, and gait symmetry. That information is sent in real time to a mobile app using Bluetooth. The app then applies a gait analysis algorithm to interpret the walking pattern. And finally, the app gives us actionable insight, identifying abnormal gait, fall risk, or areas needing rehab. That means a doctor, a physical therapist, or even a community health worker can use this data to diagnose movement disorders, monitor recovery after injury, and customize rehabilitation in real time. But how? For example, subtle shifts in stride length or foot pressure can signal the early onset of neurological conditions like Parkinson's or even complications from diabetes. These sensors can catch problems before they become emergencies, allowing patients and clinicians to act early, not after a fall or injury, but before it happens. That kind of insight is game-changing, especially in places where follow-up care is rare or delayed. It's like having a mini gait lab always with you, no wires, no lab visit, and most importantly, no delay. Here's why that matters. Let's say someone lives 3 hours from the nearest clinic. Without transportation, that diagnostic care might as well be on the moon. But with smart insoles, diagnostics become 0 minutes away because the care is in the shoe. These sensors are affordable. Some cost less than $10 to produce. They're adaptable. They work in a variety of clinical and non-clinical settings. And most importantly, they are accessible. They don't require specialized training. By making this kind of health tech mobile, we're no longer asking patients to come to the care, but instead we're letting the care come to them. In conclusion, mobility is fundamental to independence, safety, and quality of life. Smart, low-cost gait tech like these insoles empower patients, clinicians, and communities with real-time, actionable insight. By meeting people where they are, especially in rural and underserved areas, we take meaningful steps towards a healthier, more equitable world. Here are my references. I'd like to sincerely thank Dr. Lorianne Vallis at the University of Guelph Biomechanics Lab for supporting my research, as well as the STEM Fellowship Research Exploration Opportunity Program and the Johns Hopkins Global Health Leaders Conference team. To my mentors, educators, and patients who inspire this work, thank you. And to all of you, thank you for listening and for caring about a future where everyone has the right to move. If you'd like to connect or have questions following this presentation, feel free to reach out to me via my email, anaghapasumarthi@gmail.com, or find me on LinkedIn at Anagha Pasumarthi.